Jason, thanks for subjecting yourself to this.
Of course.
Maybe just a quick introduction to you and Bowie Health.
Sure. So my name's Jason Lavender. Joined Bowie Health about 5 months ago. I spent 12 years in healthcare consulting at Willis Towers Watson, and I had led their health innovation team for North America. So I was actually assessing hundreds of startups every year for large employers. I always had my eye on Bowie. They were in the consumer channel, and this summer they pivoted to sell to employer benefits, and it just kind of the stars aligned.
Got it. What does Bowie do in maybe an elevator pitch of sorts?
Sure. So Bowie is an AI-based chatbot that we have clinically trained to chat with people the same way a primary care physician would chat with people. So we essentially spent 3 years codifying over 20,000 pieces of clinical literature, built our own map of medicine, and turned that into a chatbot. So consumers right now can go to buoyhealth.com, reveal their age, gender, and their chief complaint, and then our chatbot can converse with them exactly the way a primary care physician would. At the end of the conversation, it takes about 2 or 3 minutes, and we tell you your likely diagnosis match and then the right place of care to go. So that could be telemedicine, urgent care, emergency room, or do nothing.
Yeah. Why does it matter? I mean, you can go to a doctor's office, you can go to an urgent care, you can show up at the ER. I mean, why is it so important?
Sure. Yeah, so there's a lot of stats out there. Basically 3 out of 4 people, the moment they get sick, they turn to the internet. So they're not sure what they have, they start Googling their symptoms, they find a variety of different sources, and then they typically make incorrect decisions. Everything they find on the internet could be a range from cough to something really serious. Mm-hmm. And so they're essentially...
I have cancer, I have cough, so I...
Exactly. Everybody has lupus when they start Googling. So essentially people are making decisions and choosing paths of care based on what they think they have, instead of understanding what they have and then choosing the right path of care. And as you know, all these different variances of where to receive your care cost a lot of different terms of money. So if you could save thousands of dollars by having a telemedicine consult instead of going into an emergency room, we're just trying to help the consumer.
Mm-hmm. What, and I know you're sort of recent to Bowie Health, but sort of along its trajectory, what types of partners or insights kind of helped it get to the next stage?
Yeah, so I would say a couple things. So one, our initial business model was actually providing patient lead gen for health systems, and it seemed to make a lot of sense. We were talking to consumers every day. We had millions of patients using Bowie, and it made perfect sense to say at the end of a Bowie conversation, Brian, we recommend going to this urgent care center. We've geolocated you. It makes a ton of sense. We actually did a study this summer, and we ran with 250,000 users. We asked them a question right at the beginning of the Bowie interview and said, where are you considering going for care? And they would check off telemedicine, emergency room visits, urgent care, et cetera. At the end of the Bowie conversation, we asked them, where are you now considering going for care? And there was a significant amount of behavior change. So people who were planning to go to the emergency room now de-escalated 60% of the time. And so from a business model perspective, it didn't make total sense to sell your product to a company where you're taking patients away from. So that was our main pivot into the employer world and large self-funded employers.
Yeah. Futuristic hat on, science fiction. You've created a doctor robot.
Yeah.
Is that feasible, do you think? A clinical diagnosis from a computer on your way into the office, or?
Yeah, so I think we'll get smarter and smarter over time. Our backbone for everything we do is clinical literature. We had over 25 million people come into Bowie this past year, so we're getting smarter and smarter. I think, like anything, we're really trying to just complement the physician. We're not trying to displace physicians. We think there's always types of conditions that you just have to see somebody in person, you have to get imaging done, you have to get a blood test done. So I think we can get smarter and smarter around triage, but I don't think we're ever going to try to replace human physicians with a chatbot.
Got it. And what's the next phase for Bowie?
Sure. So I think the next phase for us is, the way we think about Bowie is we're trying to fix the first step in care. That moment you get sick, what do I do, what do I have? And on our product roadmap, we're really trying to figure out now, how do we make the second step even easier? So building in different virtual services, whether it's teletherapy, telemedicine, text-based cognitive behavioral therapy, a whole variety of different services that could be a very easy, seamless second step, and just continuing to grow out that marketplace of services once you capture somebody the moment they feel sick.
Got it. Well, thanks so much.
Great. Thanks,
Yeah.
Brian. Great to meet you.
Yeah.